Radiation protection in diagnostic radiology. Radiation is always present all around us. It carries energy, so depending upon the amount of energy, we may classify radiation in two types: non-ionizing and ionizing radiation. Non-ionizing radiation carries less amount of energies and originates from various sources, such as sunlight, lightning discharges, wireless communications, scientific and medical applications. Non-ionizing radiation does not penetrate deep into the tissues but increases the risk of damage to the skin and eyes. Dependent on the energy and exposure time, non-ionizing radiation can cause localized heating. Photochemical reactions can occur with possible permanent harm. Ionizing radiation carries enough energy to break bonds between molecules and ionize atoms and may kill the cell, consequently create possible biological effect. The very common and well-known ionizing radiation are X-ray, which is used in diagnostic radiology to investigate the patients for various reasons. There are two types of biological effects of ionizing radiation: deterministic effect and stochastic or probabilistic effect. High-level doses of radiation, generally doses of more than 1 gray, if received all at once, cause short-term effect that appear within hours, days, or weeks, known as acute radiation syndrome, called deterministic effect. Initial symptoms: nausea, vomiting, and malaise. After latent period, infections, fever, hemorrhage, loss of hair, diarrhea, loss of body fluid, CNS effects. 6 gray leads to death, while low-level doses of radiation risk is proportional to dose, but disagreement or uncertainty about exact responses, called stochastic or probabilistic effect of ionizing radiation. Cancer, defects, cataracts, shortening of lifespan. If reproductive organs irradiated, genetic mutations may occur in sperm or egg cells. So, the ionizing radiations are known human carcinogens, and even a single photon may cause to cancer. Ionizing radiation should be used judiciously, and radiation protection must be followed as per guidelines of national standard stipulated by Atomic Energy Regulatory Board, Government of India. If the ionizing radiation intake within tolerance limit stipulated by Atomic Energy Regulatory Board, then the radiation harmful effect will be substantial low. If you are radiation worker, physician, radiographer, technician, operator, nurse, and attendant, then you should follow good working practice while dealing with X-ray. Remember, time, distance, and shielding. Try to spend optimal less time in X-ray and keep as much as distance with the X-ray source, and use proper shielding to protect yourself. Always operate X-ray from the control room and standing behind the mobile protective barrier 1.5 mm lead equivalent or fixed protective barrier. Always use the TLD badge at chest level while X-ray unit is being operated. Use lead apron 0.25 mm lead equivalent and wear TLD badge below the apron while dealing with X-ray. Portable X-ray equipment shall always be positioned on a stand and not to be held in hand during exposure. Quality assurance tests of the X-ray equipment must be carried out periodically. Patients are directly beneficial of X-ray, but we should protect other body part of the patient. Female patient, if pregnant, must inform the radiographer so that necessary precaution can be taken during X-ray examination. Avoid crowding of patients, relatives, staffs inside the X-ray room. X-ray room door lead lined with 1.7 mm lead equivalent should be closed during exposure. We should provide safe radiation use to public, ensuring good radiation protection in the diagnostic radiology. Only Atomic Energy Regulatory Board, that is AERB, Government of India type approved X-ray equipment shall be installed or used. AERB registration or license certificate of the X-ray unit should be displayed noticeably at the reception counter. Thank you for your attention.